first of all, what is testosterone and why is it so crucial for men's health?
Andropause is equivalent to menopause in females.
Mm-hmm.
So it's just that a gradual decline in a man's life that usually starts like around the age of 30.
What do you kind of experience in regards to prostate health and the frequency of your male clientele? Like, how often are they having these concerns? Hello, everyone, and welcome back to another episode of Wellness for Life. I'm your host, Niki Wolf, and today we are going to be diving into men's health, a topic that I love covering. We've touched upon some of our different men's health formulations, but today we're really going to get that foundational support talking about hormones and bone health and just how do we support men's health through holistic modalities. So today we're covering testosterone, bone health, prostate care, and hormonal balance. And I am excited. We have Teneika Gravely joining us today. She's a board certified family nurse practitioner with over 17 years of experience. She specializes in functional and integrative medicine. Teneika runs Tag Family NP, where she helps patients with hormone balance, gut health, and more. And her mission is to empower people to take charge of their health and live vibrant lives. Teneika, welcome to the show. Thank you so much for being here.
Thank you for having me. I'm really excited.
Absolutely. And I love that you take this functional and integrated medicine approach, and your deep down mission is to empower people to take care of their health. I think that's something that stands so true with life seasons, with our show over here, that there's sometimes certain circumstances that come our way, but how can we empower one another to take action and take charge of their health? So I think that's very cool that that's kind of your mission.
Really important to me for people to be aware of the symptoms they're having, why they're having the symptoms, try to get down to the root cause of things, because a lot of times when they feel a certain way, they go to their provider, they do labs and they're like, oh, you're fine. And they're like, I don't feel fine, but they take their word for it and they're miserable. So
absolutely. Now, was that more patient experience, or was there something that really, because I feel like people, and maybe now it's a little bit different, but people don't generally walk straight into functional medicine or integrated medicine. They might start with more of the traditional medicine. How did you begin your journey here, and why? I mean, everything that you just said, it rings so true, but sometimes it takes people to get to that understanding of like, we need to get to the root cause.
Mm-hmm. So usually what happens is when a patient is experiencing a symptom, casebook scenario, they'll deal with it at home for as long as they can. Once they can no longer deal with it, that's when they resort to drugstores and buying everything off the shelf. Once that doesn't work, then they go to their primary care provider. They'll run basic labs, may or may not do some imaging depending on what their symptoms are. And then everything usually comes back within normal limits, which means that you can have a lab test with, for example, vitamin D, 25. Their lab ranges from 30 to 100. So there's no way two people are going to feel the same with that big of a gap for a lab range. But because it falls within that range, they'll say, oh, you're fine. And they say, okay. But then they'll continue to complain about symptoms. So usually by the time they get to me, they've been to the primary care provider, they've been to several specialists, and they've been told that nothing's wrong, nothing's going on. And that's primarily because a lot of the tests and treatments are based off of insurance as well, which is very limited, unfortunately. And insurance doesn't cover a lot of the labs and some of the specialty labs that we do. So when they come to me with a stack of notes, of progress notes from their doctors, all the labs they've had drawn, imaging if they've had it. Everything, yes, does look normal, but then we kind of do a deep dive. And that starts off with redoing their, initial intake, looking at symptoms. When did this start? What was going on? Where were you? Even, depending on what their symptoms are, we look at the environment that they live in. Do they live in an old home? Is it environmental? Is it nutritional? So we kind of do a lot of deep dive. In the beginning, it is a lot of work, and then we kind of just take it from there. We do primarily focus on using nutrition as medicine. Initially, lifestyle changes, sleep, stress management, supplements if needed. And then if absolutely needed, we move on to prescription medication, but we kind of leave that towards the end.
I love that. That is the foundation, I believe, of, functional medicine and integrative health, of let's do the deeper diving and the testing to figure out what's going on. Because I have a lifetime of experience. I was in the hospital since I was 3 years old. And so I've used Western medicine for so many things. And for certain issues, it wasn't until I moved over to integrative health where we did this functional testing. Because, you look at thyroid, traditional doctors are just going to check the very basic levels of what your TSH, whereas functional lab work is going to do all the underlying testing. And so TSH can show up as normal, but then when you see your T4, your T3, and all of that's out of whack. And so, gosh, I try to encourage so many people. The power of functional medicine and integrative medicine is monumental for your health. And a lot of, sometimes insurance doesn't cover it or it's out of pocket, but man, nothing has been more worth it in my mind, because you're getting that time and that energy. My first appointment with my naturopathic doctor was an hour-long appointment, no rush. Whereas regular traditional models, you're in and out. And so they don't have the time to go into this stuff. But you nailed it when you said our first approach is diet. Then we look at lifestyle. Then we, I'm sure you look into sleep and stress, supplements. And then the very last option is going to be, procedures and medication, which there's a time and a place for that. We talk about that on the show. So I absolutely love your approach. I know today we're going to be focusing a lot on men's health. Have you seen kind of, in your experience working with both men and women, have you noticed major differences in how men approach their health, and particularly when it comes to hormonal care or preventative care? Have you seen a major difference?
To be quite honest with you, most of my male population comes from my female population. So it's the spouse or the brother or a family member or close friend. Men have to feel pretty bad before, usually, not all, but usually they have to feel pretty bad before they seek care, unfortunately. And I don't know if it's the toughness behind it,
Yeah, I would say ego's probably, and I don't mean that in like a negative connotation,
not even
but just
like,
yeah, I could see how that, or like just generally men need to be tough, or the providers, or, and so, I'm married, and I think a lot of times women, we get like a little bumper bruise and we can easily like, okay, what is it? And we'll go down this rabbit hole. And so we want the answers now. Whereas men are like, I'm going to wait till my arm falls off and I'm bleeding out of 6 areas.
Wait till it change colors and there's no more circulation. And then we may go get it checked out and see what's going on. And still don't really want treatment after that. But, I have found that once they're educated, they kind of get into things a lot deeper than women. I think initially they're a little hesitant, but then once they get into it, they're really into it and they're really focused and dialed in. So that's always a joy and a pleasure. I really enjoy working with my male population.
Yeah, I can imagine. And they start experiencing these benefits and seeing how good they feel. And so it's kind of a momentum to continue going forward. Now, we're going to first kind of explore testosterone. We'll get into prostate health and bone health, but testosterone, a crucial hormone that women have as well. But obviously this is a very important one for men. Men typically have much higher levels. Why? First of all, what is testosterone and why is it so crucial for men's health?
Sure. So testosterone is responsible for the development of male characteristics like muscle mass, bone density, body hair, and deepening of the voice during puberty. So it also supports sex drive, sperm production, mood regulation, and naturally over time, the levels decline with age, and low levels can lead to a range of health issues. Most of them are also associated with what's called andropause. So there's a difference between low testosterone and andropause. So low testosterone, or you'll hear people call it low T, it's a medical condition where testosterone levels fall below normal range for a man's age. It'll naturally decrease with age, but actual low T can occur at any age. That's usually from like chronic illnesses, medication use, lifestyle, hormonal imbalances. And it will lead to symptoms like low libido, fatigue, muscle weakness, mood changes, erectile dysfunction, even weight gain. So while aging is a common cause, low testosterone usually stems from other conditions like hypogonadism or pituitary disorders.
Okay. And pituitary, I mean, that's your main gland that really creates the signaling pathway for everything, every other reaction in your body, correct?
Right. So the pituitary gets its signal from the hypothalamus. The hypothalamus sends a hormone called GnRH to the pituitary that kind of says, hey, let's get things going. Let's get things started. The pituitary then sends two hormones, luteinizing hormone, LH, or follicle stimulating hormone, FSH. Sends that signal down to the gonads to kind of get the production going of testosterone. That's where male testosterone comes from. There's also a little bit that comes from the adrenal glands, but it's mostly from the gonads. Then there's andropause. Andropause is equivalent to menopause in females. So it's just that a gradual decline in a man's life that usually starts like around the age of 30. It drops 1 to 2% per year. During andropause, it's different than with women in menopause, because with women in menopause, things kind of happen quite quickly. As with men, it's just a gradual decline. So men won't experience the highs and lows, the ups and downs like females do. So that's the big difference there. But with andropause, they still can experience things like fatigue, mood swings, decreased sexual function, cognitive changes. So some of their symptoms are similar to what women experience during that time in their life.
Yeah, absolutely. We have a supplement, a testosterone support supplement, and it's called Masculinity. And I always say when I'm educating on it, think of the M, mood, muscles, mojo. And kind of just like when I have only 30 seconds with them to help them remember what testosterone is doing in the body, it's going to help support mood, kind of like get you in the groove. I think about like your, just your energy, your charisma, your confidence, muscles to build muscle mass. Cause there's, like you said, it can help support muscle growth and development. Or if you have extremely low levels, I used to have customers that come in and say, I'm taking creatine and protein powder and all these supplements. I'm working out, I'm eating protein and calories, and I'm not putting on muscle. But then they did the deeper work and their levels of testosterone are low. And so crucial for the muscles. And then mojo, again, mood was more of like the libido mood, and then mojo is kind of like what makes them feel really good. But I mean, we talk so much about hormonal health, and I think the focus, whether that's like mainstream media, is always women's health when we're kind of referring to hormones, but it is so important for men's health, again, for the testosterone, to make sure that these levels are balanced, because like you said, it's not an overnight thing, whereas kind of menopause, it can be very intense and dramatic in a small amount of time. This is like spread out through a long period of time. So it might be easier to just glance over.
Usually that's what happens in the male population. And again, because men don't report their symptoms as much as women do, they kind of wait until it gets to the point of, I don't want to say no return, but until it, the symptoms are really heightened. And again, it usually happens. It starts to happen around the age of 30. It can definitely happen prior to that under certain circumstances. For example, if they have chronic illnesses, if they're on certain medications like opioids or steroids, those with history of cancer that have to undergo chemo or radiation treatment. And also if they're on like antidepressants or antipsychotic medication that can cause low T at an earlier age. And it's also a lot of environmental factors now, and environmental exposures, and depending on where they work. Are they firemen? Are they exposed to a lot of chemicals? Do they golf a lot because of the chemicals that are sprayed on, the grass and the golf course? So there's a lot of factors that are involved on what the cause of low T is.
Yeah, I didn't even think about the golf course. It's funny. My mom lives on a golf course. And so when I go over to visit, she's like, don't put my daughter on there because all the chemicals. But I didn't even think about it in the like endocrine disruptors. Like it's going to mess up, and I mean, generally it's a majority men golfing. And if you're golfing regularly, how you start breathing that in and how that can start and they're already, I wouldn't say generally older. I mean, I guess if I have to pick the average range, they're already in this season where their levels of testosterone. Right. Yeah. So it just aggravates it. Now, you mentioned earlier, okay, actually before that, when we're talking about holistic modalities of supporting testosterone levels, I know that there's certain herbs and ingredients, long jacks, tribulus, maca, fenugreek, supportive of naturally boosting our testosterone levels. What about in terms of maybe diet or stress? Are there certain lifestyle factors that can move the needle for testosterone levels?
Definitely. So what I do initially is during that initial intake, I want to know what their occupation is, even what type of, and some people look at me strange, but what type of home life did they grow up in? Do they have any past traumas, anything that's causing constant stress? Because that's pretty huge. Are they sleeping well? Are they exercising? What are they putting in their body as far as nutrition or even as far as supplements? Because as good as some supplements are, we can overtake some things and it'll have the same effect. So those are definitely things that we do look into. For example, with stress, we know that stress is not bad all the time, right? So there's different types of stress. There's stress because you have an exam coming up or you're planning a wedding or, you have a certain event, maybe a speaking event or something. Fight or flight, right? That's we're okay with that. But when you're in a steady state of stress, that's when it starts to affect the HPA axis, your cortisol levels. Cortisol is diurnal, so we expect it to peak in the morning, gradually decline throughout the day, drop at night. Your melatonin kicks in, you have a nice restful sleep, and then same thing happens the next morning. When you're in a constant, steady state of stress, that interrupts that rhythm. And that rhythm either doesn't peak the way it's supposed to, and then it kind of flatlines, which is not good because when that happens, it's an example of chronic inflammation that can lead to cardiovascular issues. It can lead to early onset dementia and things that we just, those are roads we don't want to go down. So those are all things that we definitely want to address initially, even before talking about testosterone replacement therapy. Those are all addressed. They're giving little homework assignments to say, okay, this is what I need to do. And things are done step by step. We're not expecting, things to be done in a 24-hour period. We're all human. But those are definitely things that we want to address initially, even before I draw labs. I say, hey, let's, start tackling this right now. The other thing that I also bring up to them is just to have some type of consistency in their daily routines, because a lot of people, especially if they have high stress jobs, they're not sleeping at night, or if they work night shift, that's another thing that needs to be addressed. Things like sleep apnea, do they have sleep apnea? Have they ever been tested? Are they wearing their CPAP? So there are a lot of things that we try to address even before placing them on testosterone replacement therapy.
Fantastic. I love that. I think there's so many different ways that we can approach this. And maybe a guy's like, I'm not willing to do this, but I can try this, this, and this. And so there's a variety of things that we can choose from and get started with. Now, earlier you mentioned the role testosterone has in our bone health. What does that look like? And I know, osteoporosis is what I feel like I've heard it's like 70% postmenopausal women. So it's generally women are always the focus when it comes to bone health. So I can see how that's generally overlooked, but how does osteoporosis affect men and why is it important for them to focus on bone health?
So with men, like you said, osteoporosis is usually women related. When you hear osteoporosis, you think of a woman in her postmenopausal years. But it can also affect men. And if you think, I remember being a bedside nurse and having older patients, especially on the post-op floor. Every once in a while, we'll get a gentleman in who's come in for a hip fracture because they've fallen. And I remember this one particular patient who was in his 40s and he had a hip fracture, came in for a hip replacement. And I was wondering, I'm like, oh my gosh, you're so young. How did this happen? And he did tell me he was on anabolic steroids. He abused them. And unfortunately, that's one of the side effects, that can happen with that population. So it's important for males to know that osteoporosis is not a woman disease. It definitely can affect men, especially men who have low testosterone levels. It plays a significant role because as bone turns over, the role of bones is, or bone marrow is just constant turnover.
Okay.
When you have low testosterone, that can lead to hypogonadism, and that reduces bone formation and then increases the rate of bone loss. So that essentially is what happens as one of the causes in males. Age, also a factor. Again, testosterone starts to decline at the age of 30, and men reach a significant bone loss typically around the age of 50. Okay. There's also lifestyle factors. So if you lead a sedentary lifestyle, you're not doing or keeping up with weight-bearing exercises, especially in your later years of life, that can accelerate bone loss. The other thing is smoking and alcohol. So that's a part of lifestyle. Both smoking and alcohol will decrease bone density. Then other medical conditions, if you have, which is really rare in males, but if you have hyperthyroidism, that can affect bone health, chronic kidney disease, GI disorders, and things of that nature. And again, if you have a strong history of needing steroid use like prednisone. So if you have males who have COPD or asthma or autoimmune diseases and just have a history of being on steroid use for long periods of time, that can lead to bone thinning. So all those things combined places a male at higher risk for osteoporosis.
Absolutely. And one thing, and maybe if you can help correct me if I'm wrong, from my understanding in regards to bone health, it's really between the ages of 0 to 30 is your opportunity to build as much bone as possible. After 30 years old, that's when we really start kind of like, what is it? Osteoblasts and osteoclasts. Like we start breaking down the bone. And so a lot of people think, okay, to take a bone support formula, let's focus on bone health when we're 50, 60 years old. But it's like really the 0 to 30, granted, you're a child and an infant, but that is the time that's so important. And I think about what you're saying, because, my family is very invested. We do a lot of work with, addiction treatment. And so whether that's alcohol, drugs, you're talking about smoking, alcohol, pain medications, the combination of all of those, I mean, each one individually will kind of affect your bone health. And I just want to clarify the actual science behind. So doing those three things can reduce your levels of testosterone. And testosterone's role in bone health is that it helps with the turnover of bone marrow. Is that correct? Or I kind of just want to hone in on what testosterone is doing specifically for the bones.
Testosterone in males can aromatize to estrogen. So with that aromatization, if you have low estrogen, and this is for both men and women, if you have low estrogen, that's what would lead to the breakdown of that cycle of turning over and kind of making that, it'll increase the turnover for bone. So that'll decrease the density and lead to bone thinning. And then that's what can lead to the osteoporosis.
And when you say aromatase, because isn't there, like, there's an aromatase inhibitor? Like, I know testosterone can convert into DHT, and that can like increase balding in men. Mm-hmm. The aromatase, that's the piece that kind of converts testosterone to estrogen.
Testosterone can turn over to estrogen via aromatization. And during that time, you have receptor cells, right? So either that testosterone is going to grab on to an androgen receptor cell and kind of just do its thing of what it's supposed to do with, as far as the testosterone route. Or it's going to aromatize into a form of estrogen, and it's E2 that men have, because there's three types of estrogen. There's estrione, estradiol, and estriol. Okay. So in men, E2 is the primary form of estrogen. It occurs primarily in fat tissue. So again, if they have a higher body fat percentage, they're at higher risk of aromatizing. The testosterone, when it enters the cell, it's lipophilic. So that means it'll easily pass through like the lipid membranes of the cell.
Okay.
And that conversion is natural, and it's good. It's a good thing. It's not a bad thing, but it has to be equally balanced, right? So if you have too little estrogen, that can lead to bone loss, decreased libido, mood swings, joint pain. If you have too much, then that can lead to gynecomastia, which is enlarged breast on males, increased body fat, water retention, mood swings, and again, reduced libido. So testosterone and estrogen is pretty much tightly linked. They work together, and you just have to keep it at a good balance. But that's usually what happens is testosterone is going to enter the cell, and it's either going to grab onto an androgen receptor or it's going to aromatize into E2.
And I can imagine this decision of what the testosterone does is influenced by your environment, your diet, your lifestyle, genetic makeup. And so, I mean, I'm sure there's certain circumstances where you could do a deep dive to figure out why did it attach to this versus this. But I'm guessing when we can kind of hone in on these holistic factors, we can increase our probability of it going to an androgen.
So say, for example, if they're on testosterone replacement therapy and they're not dosed correctly, or their frequency isn't correct, then that can cause aromatization. If that coupled with higher fat body percentage, that's going to increase their risk even more. So it's really an individualistic approach. No two people are going to be the same. Lifestyle factors are huge because that's going to affect not only the testosterone and the estrogen, but you have to also look at the sex hormone binding globulin. Mm-hmm. Is that elevated or is it too low? That's usually treated with lifestyle factors. because that's what the testosterone is going to bind to. So then how much free testosterone is in the body, how much is binding, and then how much is actually aromatizing to estrogen. And ironically, there are some providers, it's a little controversial because there are some providers who don't want to even check the estrogen because it's an intricate hormone and it kind of does what it needs to do and then it leaves the body. So some are saying, okay, well, at what point do we test it? Then there's not really an agreed upon optimal range for men. So they're not really sure how to interpret it. And then it's, okay, well, if we interpret it and there's really no baseline for interpretation, are we unnecessarily treating it because they'll be prescribed an AI, like an aromatase inhibitor, like an estradiol, so that blocks E2. So then when you get to that point of blocking that production, now you're robbing him of cardiovascular benefits, you're robbing him of brain health, you're robbing him of bone health. So that's kind of where the controversy comes in at. Are we over-treating? Do we treat? Do we even test? Should we test? Do we only test when they have symptoms? So it really depends upon the provider, the patient, if they're experiencing symptoms, and then what ways to treat. Usually you can treat it. How I treat it is we just do dose adjustments and frequency. So I usually treat men twice a week with testosterone injections. And it's very rare that this happens, but if they do have high estrogen, we usually move them to 3 times a week. And that usually fixes it.
And this is generally after you've implemented or they've implemented all these other lifestyle diet factors incorporated that. Yeah. It seems like it's such like this is why functional medicine is so important, that you can get hands-on, you can know this patient, know their story. Whereas, a quick turnover in Western medicine, you don't have the opportunity to kind of deep dive. And so you almost have to quickly figure out a plan.
Mm-hmm. You probably have 15 or 20 minutes with them
exactly
at best.
Well, I'm also hearing, based on just this conversation, how important lifestyle in regards to maintaining a healthy weight is for not only bone health, but testosterone health. Building healthy muscle and focusing on strength training is so crucial, not just for men, but for women as well. And I think, over the last few years, we've known that even from a women's standpoint, that we need to be, lifting weight, the importance of that, but we could just clearly see how that's impacting on a deeper level. Now, we've covered a lot in regards to testosterone. I kind of want to shift over to prostate health because this is a big one. Generally, I would say if it's not a matter of when, or it's not a matter of if men develop prostate issues, it's when. And I've kind of always explained it. I haven't educated on it in a while, but like the prostate is, this gland, and it's surrounded. Well, actually, I'm totally blanking. I haven't educated on it in a while, but it's kind of like a donut where I believe the urethra surrounds the prostate. Mm-hmm. And so when that prostate becomes inflamed through diet, lifestyle, environmental factors, it starts putting pressure on the urethra, creating this nocturnal urination, frequent urination, not complete emptying of the bladder. And then obviously we could develop stuff like BPH and more serious issues. And so we really need to focus on how do we reduce and heal the inflammation. But what do you kind of experience in regards to prostate health and the frequency of your male clientele? Like, how often are they having these concerns?
Honestly, my population is not in that range as of yet, unless they've had a family history of prostate cancer. Then that's kind of when we do the deep dive.
When you say in that range, you mean just you generally have a younger audience or younger clientele? Okay.
Mm-hmm. So usually what I do, I still provide education on prostate health. I explain to them, what the prostate is, what happens, what's the sign and symptoms, things to look out for, what the PSA levels are, what that means, because we check PSA levels, obviously, on everyone we do.
And what is that?
Testosterone. PSA, specific, prostate specific antigen levels. So what we do is the PSA is like a protein that's produced, by both normal or malignant cells. They're measured through blood tests, and they can help screen for prostate cancer and just monitor prostate health overall. So normal PSA levels, typically are below 4, and that's air quotes considered normal because it can, vary from person to person, and it automatically, there's a slight increase with age. So when men are in their 50s, usually you can expect the level to be anywhere between like 0.7 to 2.5. And again, it can vary with everyone. If the levels start to climb, it doesn't always mean cancer. It can mean several things. It can just be if you go and get a PSA level checked and you were sexually active the day before, even if you did bike riding, things like that can elevate your PSA. If it's someone that I just recently started on testosterone replacement therapy, that can also cause a slight bump in the PSA, and we just have them repeat it. And usually we tell them to sustain, from sexual activity or anything that's going to aggravate that area. And usually it comes back down without a problem. But the things that a high PSA will indicate, prostate cancer, BPH, like you said, or prostatitis, which is just like inflammation of the prostate. Usually you have them repeat, you do imaging. If something is still off, and the levels are continuously going higher, then you send them to a urologist. But I always encourage a biopsy to be the absolute last resort after everything has been checked, because usually once you get a biopsy, men definitely complain of, like erectile dysfunctions and low libido and things of that area. And you usually can't get that back. So
are there any kind of major signs or symptoms that men should be looking out for, especially as they get older?
Mm-hmm. So usually, frequent urination, especially at night, weak urine stream, or difficulty just starting urination, pain or discomfort during urination. There could also be blood in the urine, or the semen, erectile dysfunction, and just pelvic pain in general. So those are some of the big things. And ironically too, I usually say if you do have, pain in that area and they're sexually active, they obviously should. That should be one of the first things they do is, get a STD screening as well.
Absolutely. I'm hoping that blood in the urine or semen is a big enough wake up call to men to go in and go get yourself checked. I'm guessing, again, diet, lifestyle, all these contributing factors to help support prostate health. Anything else that comes to mind that's a pretty big standout that can kind of move the needle and improve prostate health?
Diet and lifestyle is definitely huge. Diets that are high in fat, red meats, low in like fruits and vegetables and things like that, that will definitely cause, or increase the risk of prostate cancers. So you definitely, that's huge, honestly. One of the biggest things. Hormonal changes. And just when we say hormonal changes, people usually focus in on sex hormones alone, and they don't think about thyroid or cortisol. So you want to make sure that everything is optimized, in that area. And then the other thing that just off the top of my head is just, you would think it's obvious, but just cleanliness. Because you want to decrease the risk of infections, or that can lead to chronic inflammation, and then that can cause some issues as well.
Fantastic. Thanks for laying that out. And again, we have a supplement formula to help support prostate health because sometimes, we want to integrate diet, but we don't want to change our lifestyle. And so, supplements are not a one size fits all. It's designed to supplement everything else you have, but at least that there's something that can help support the inflammation, help the urine flow, because I know that that's a huge issue, is that nocturnal urination. And if you're constantly getting up in the middle of the night, that's affecting your health and the quality of life throughout the day. And so it's so important that we kind of hone in and get that covered. We've covered a lot today. We've covered a lot of different science. Is there any components in regards to men's health that you feel like we haven't touched upon or maybe haven't dove deep enough on that you think is important for listeners to hear?
Well, let me just start with prostate, because there was one thing that I did want to bring up, just so men are aware that when you were discussing BPH, which is the prostate enlargement, that it is common, as men age, that their prostate enlarges. And usually like by the age of 60, about 50% of men will be diagnosed with BPH. And by the age of 85, that number jumps up to 90%. So it is something that, that can happen. It shouldn't cause like a huge alarm, but if they start to experience the symptoms, obviously you do want to go get checked out, so that things can be put into place to minimize the side effects and signs and symptoms of that. The other thing that I wanted to bring up is for those that are on testosterone replacement therapy, two important things to know: that if you are being treated, there are some males who actually request aromatase inhibitors because they don't want the gynecomastia, the enlarged breast. So I actually have males call me and say, hey, I want to be on testosterone replacement therapy, but I want you to put me on an AI too. So it's important that you are educated to know that even providers that I know that use AIs use them very sparingly. And it's not something that shouldn't be your goal with testosterone replacement
And
therapy.
we're concerned about using it too much because we still need to make sure that we have estrogen in there for bone health and for other things, correct?
For cardiovascular health, for brain health, for bone health. And that's the things that your provider is focused on. And, even though the guys are focused on how they look, we're more focused on what things are going to be like for you in the long term. And then the last thing I want to bring up is with TRT treatment, to keep an eye on your hematocrit levels, because a lot of guys who kind of treat themselves too. I know that there are some people, unfortunately, who kind of buy the research drug off Amazon and kind of treat themselves. If you have a high hematocrit, your go-to treatment should not be phlebotomy, because if you do constant phlebotomy or blood dumping, is what some call it, you're going to put yourself in a anemic state because you're losing large amounts of ferritin. You'll become anemic. Everything's going to get thrown off anyway with your TRT treatment. So that's definitely something that you don't want to resort to as a treatment just so you can continue to take high levels of testosterone replacement therapy. You may be okay right now. You may feel okay right now. But again, we're looking years down the line for you. We're looking at longevity. We're looking at health. We want you to be a healthy 70 and 80-year-old and not stuck in a nursing home in a bed because of some of the decisions that you've made, while you were younger. The other thing too is if you're going to take hormone replacement therapy or peptides, anything like that, you just want it to be in an optimized environment. So you definitely want to make sure that you aren't smoking, that you aren't drinking, that you're getting, rest, that you're eating as healthy as possible. Again, we're all human. So cheat meals, okay. but just overall, you just want to make sure that you're getting those nutrients in the vegetables, the fruit, and things like that. There are people who think that they can just do these quick shots or these quick treatments, and they don't want to put in the work with anything else. And ultimately, you're not doing yourself any service. You're doing yourself a disservice taking that route. So,
no, that was fantastic key points right there. And I think it's so hard. I mean, generally it's when we're a little bit younger, when we're really focused on the way our body looks and our aesthetic. And I can understand for males, when you grow the larger breasts or you have a bigger belly, how you're almost willing to do anything and kind of sacrifice everything else. And so you're like, all right, if my doctor's telling me no or to slow down on the aromatase inhibitor, well, I don't want to listen to that because I need to make these changes. So that's why it's important too to have a provider that you trust, and I think an informed provider who also can think critically and can make these decisions that, frankly, I don't agree that this is a good idea. A lot of times, it's for a quick buck. We want to do this. And so it's really important to look at the big picture. But I also understand, I know when I'm in my 20s, you don't care about the next 20, 30, 40 years. You're like, I just want it now.
So nothing's going to happen to you.
Exactly. And so that's why it's like laying out the consequences of what could happen, I think are really important. And again, I think that's where a good provider to be able to have this dialogue in a compelling way to hopefully get the point across of like, let's start with this first and then we'll adjust and kind of feel it out because you also want to meet their needs, but then you also have to do it looking at the future of what their health is going to be. So I love everything that you just said. Teneika, where can people find more information about you, the work you do? I know that we just covered men's health today, but I know you cover a variety of topics and conversations.
Yeah, so my website is www.tagfamilynp.com. We do cover hormone optimization in both women and men, as well as gut health, neurotoxins, peptide therapy, and weight loss. I am creating webinars as well on different topics, and there'll be free webinars just to put out more education. I just want people to be as informed as possible, and just so that you can know what to expect when you go to your provider, what to ask for, and what type of treatment options that you have. And I will hopefully be starting a podcast by the end of this year, just covering various topics for hormone optimization and other services that we offer.
Fantastic. Well, thank you so much for sharing your knowledge, your insights today. I know our listeners are going to walk away with so much important information. I know that there's pieces that I learned today. So I just appreciate your time and your energy and covering this out, getting into the weeds of the science. I always love. We fully accept that here. So I appreciate your time today, Teneika.
Thank you for having me. I really enjoyed it.
Absolutely. All right. Take care.